Mid-facelift, cheek lift, eyes. What should I do? I am thin and have a ton of extra skin on my face, which makes me look older. I've been told that a mid-facelift and under-eye surgery is the way to go, but I'm not sure. Aren't there different mid-facelift options and different ways to do the procedure? Which one is best? How am I paid looking too tight or the plastic surgeon not taking enough skin off? Are there different ways to minimize scarring too? I don't want fillers because they do not last long on me, so surgery is way more cost-effective for me.
Thank you for your question. You submitted several photos of your face from different angles, from the eyes downward, from the rim of the lower eyelid downward, and you state that you're very thin and that you have a ton of extra skin on your face, and you're trying to determine what type of surgical procedure, facelifting, mid-facelifting, under-eye surgery is appropriate for you, and you comment that fillers don't really last on you and that that surgical procedure would be more cost-effective. Well, I can share with you my perspective on situations like yours, where people come to our practice every day with similar concerns. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. There has been certainly an evolution in the way I address situations like yours in my practice, as I've been able to develop a more modern understanding of the facial aging issues that are relevant, as well as having more tools at our disposal to optimize the outcome that I think will best serve my patients. So to begin with, since you haven't submitted the photos of your eyes, I can't comment on the relative merits of having under-eyelid surgery. But I would say that when you look at your face and you consider any surgical procedure or any intervention, you have to be able to first define the problem and then define the solution. And so it is understandable that when you have a very thin face that you feel like you have a lot of extra skin. But when we think about what is it that we accomplish when we do facelifting surgery, we're lifting sagging cheeks, we're improving the jawline, we're improving the neck angle. In the photos that you submitted, certainly those areas don't seem to be sagging significantly. And so you have to ask yourself, what kind of outcome will you have? Whether it is you do a regular facelift or whether you choose to do a mid-facelift. Now, as far as the mid-facelift is concerned, certainly there was a lot of mixed opinions in our community about the benefits of mid-facelift. It is my perception that mid-facelifts are really not necessarily addressing the full needs of a patient who feels that they need enhancement of the mid-face area. And why is that? Well, by the definition, if you are lifting something, it must have been sagging or it must have dropped. And my perception is that people who want improvement in the mid-face really are looking to have some volume. Now, that being said, we certainly can appreciate there's always the opportunity to combine approaches. But with your experience with fillers, I could understand why you are hesitant to deal with fillers, because you feel that they don't last very long. And I can imagine that when you've had fillers done, you've probably had a couple of syringes placed, and each syringe is not a lot of volume. But generally speaking, these fillers are placed just below the skin. And when you're dealing with skin as being the structure that's holding the filler, well, you stated that your skin is very redundant. And I would say that is probably the skin itself is very stretchy or elastic, which means how does the filler really provide structure in that way? In our practice, we do something called structural volumizing, and it's basically dealing with the true issue for people who are at this stage of life where they may feel by pulling back that they look better but are really in need of volume. And this is a very significant milestone in the approach to dealing with facial aging. I would say that when we look at people's natural aging process, that the two things that are very important are volume loss, which means loss of bone, muscle, fat, as well as sagging. And when you think about the third, fourth, fifth decade of life, you're dealing more with volume loss. And when you think of the fourth decade onward, you're dealing with some sagging. Now, when you think about a situation like yours where you have a thin face and you have relative skin elasticity, well, you have to think, is the structure really going to make that much of a difference when you pull the skin taut? Because understand that when you're dealing with the perception of extra skin, the skin intrinsically has stretch, which means that you may have a short-term benefit from a lift where you feel like good about the skin feeling tighter, but the skin will have some degree of stretch, and you may not get the full potential outcome. Now, there still may be some benefit of doing a limited type of facelift, but I would also submit that there is also an opportunity with a concept that we do in our practice called structural volumizing. Structural volumizing is the application of long-lasting fillers, such as Juvederm Voluma or Juvederm Ultra Plus, at the bone level, between the bone and the muscle. In doing so, we are really addressing the true underlying issue with facial aging at this stage of one's life, which is volume loss. By doing that structural volumizing, you actually enhance the youthful appearance of the face by restoring natural ratios, such as the golden ratio, so that the face looks younger by restoring volume, let's say in the cheek area, in the jawline, the chin, and you can really get the results that can appear to look like you've had a facelift when this was all done with fillers under local anesthetic in 30 minutes. Now, this is not to be confused with the liquid facelift, but structural volumizing is a very specific approach and technique where you can get the results that look like a facelift, and thanks to volume correction, you can actually exceed the appearance of a facelift in a particular situation where volume is more relevant than sagging. And you might be able to achieve what you want, get some longevity, such as up to 2 years with these fillers, and maybe defer having a more aggressive surgical procedure. I think it's worth learning about, because I think that the confusion is often there because there is perception of what the outcome will be with surgery. There is the natural bias of surgeons who want to do these types of surgery. And I could say that because essentially when I go to meetings and I look at results that are presented of befores and afters, and I think, well, if this person did a mid-facelift or a facelift on that patient, I probably would have chosen to do something different, such as fillers, and avoided the procedure altogether. Now, I'm a surgeon and I certainly love doing surgery, but I feel like the art of helping our patients is an understanding what are the elements that make the most impact with the least invasive approach and is ultimately going to give the patient the best outcome for what they want. So I think learning about structural volumizing will be one more thing for you to add to your list of things to learn about, and look at your face from that perspective about structure and volume rather than just sagging and lifting. So I hope that was helpful. I wish you the best of luck, and thank you for your question.